my name's Adrian Richards. I'm a consultant plastic surgeon, and today I'm going to be talking a little about what actually happens when you have a breast augmentation. So, what happens when you come in from the hospital, what happens at the operation, what you remember, the recovery period, and when you can get back to activities. So the first thing is that normally you will have seen myself or one of the other surgeons who would have discussed the sort of sizes of the implants and the best option for you. Then you would have had an opportunity to sort of really look at the implants. That's about an hour appointment, which we talk about in a separate video. We call that the sizing appointment, where you get to sort of see how the implants look on you. So, but once you've made the decision that you would like to go ahead with the procedure, what normally happens is about a week before the operation, you'll be contacted to be let know what the best time to come into hospital is. Okay, so there's certain things that are important. Before you come in, you need to sort of take it easy over the weekend. Don't do anything too stressful over the weekend. Try and sort of avoid alcohol over the weekend, and certainly try and avoid smoking for 2 weeks before surgery. Don't take any medication like aspirin, Nurofen, Voltarol, because they can cause excess bleeding or increase the risk of bleeding, so it's important not to take those. Other tablets which are more homeopathic, we don't like you taking ginkgo, vitamin E, and St John's wort. Again, these have a potential risk of increasing the risk of bleeding, so please don't take those before you come in. So essentially, a restful weekend before you come in, take it easy, don't come in all sort of stressed and tired. When you come in, you'll be brought into the hospital and meet the nurses, and then they'll admit you. So that means they're going to do lots of blood tests, and they listen to your heart, check your blood pressure, all those sorts of issues, and then get you into your gown. At that stage, I'll come and see you, and we'll again go over the sizes of the implant, nature of the operation, and I'll draw on you. So it's important that the markings I make on you are really to help me inside, to sort of make sure the breast implant's sitting properly, seated properly, and everything's nice and symmetrical. Then normally my anaesthetist will come and see you as well, and I have a lady anaesthetist normally who will come and discuss, from her side of the operation, check that you've not had problems with anaesthetics before, go through the questionnaire and sort of make sure you're okay for the anaesthetic and answer any queries you may have. Then you go down to the operating theatre. We do like you not to have eaten anything for 6 hours before the operation, and you can drink what we call clear fluids up to about 3 hours before the operation. And clear fluids, basically watery fluids, not orange squash with any bits in it, so nothing with any bits in it. And the reason for that is because we don't like anything in the stomach when you have your operation, so we like it all to have been cleared through. Okay, so you go down to the operation. We would normally remove any external jewellery or tape it. So if you've got a belly button ring or tongue stud or earrings, we generally tape those before the operation. We also don't like you to put any body oil on before the operation, for 2 days before the operation, because that can interfere with the antiseptic ointments we put on. The other important thing is if you don't want to wear those horrible hospital underwear pants, bring in some pure cotton pants for you to wear, because anything synthetic interferes with some of the machinery, so you can't wear anything with synthetic fibres in it, but cotton's fine. Okay, so you go down, have your operation, you are put to sleep, normally put numbing cream on the back of your hand before the operation. There's a little drips put in there, it shouldn't hurt because of the numbing cream. Then you just sort of gently go off to sleep, and often patients, when they wake up, don't actually realise they've got to sleep. You sort of say, when's it going to happen? Don't realise it's happened. And then in the operation, I'll put local anaesthetic in around the breast tissue, so it shouldn't be sore when you wake up. It's very important. You wake up, you shouldn't be in pain. It's very rare now for any patients to feel sick after the operation. So with old-fashioned anaesthetics, people tend to feel sick. Generally, you shouldn't feel sick. You you should be, when you wake you up nice and slowly, but you should be, if you have it in the morning, you should be having lunch at lunchtime. Okay, so that evening, it does tend to become slightly more tender and swollen because the local anaesthetics are worn off. So we do give you painkillers. We normally give you IV paracetamol. We give you antibiotics to ward off the infection. We also give you normally Celebrex, which is a non-steroidal, which doesn't upset with your tummy, and we sometimes give you codeine. So we really look after the tenderness in that first period. You normally stay overnight with us. You'll be in a bra. You stay overnight. You'll be checked in the morning. If everything's okay, you'll go home, and that rest of the week is really sort of take it easy at home. So you can, go around, go for walks, gentle walks. Don't just lie in bed. Keep moving, but nothing too strenuous. And certainly no hoovering, no household chores, and don't lift. If you've got young children, you won't be able to lift those up. You won't be able to handle a car seat for the first week, and no driving for the first week. Okay. Then when you leave, you'll be making an appointment for approximately a week in the dressings clinic. If you've got any concerns in that week, all you need to do is just contact us, and someone will talk to you. So, or if necessary, we can get you back in and check everything. So please don't, if you're worried, 90% of things can be insignificant, are not a problem. Very common to have sort of one breast slightly more swollen than the other, and if you ring us, we can give you reassurance on that. At a week, we would see you remove the bra, remove the brown tape, and just trim the ends of the absorbable stitch and reapply some tape. And at that stage, it's important to have bought a C and D cup support bra. Normally we recommend Marks and Spencer Total Support Bra, which we'll swap you into at that stage. So one tip patient mentioned is keep the labels on, and then you can take it back if it doesn't fit perfectly. Okay, and then at that stage normally okay to drive, and then we encourage you just to resume normal activities slowly. Aerobics normally it's sort of or exercise, lower body exercise. You need to wait 3 or 4 weeks for. Then we see you at 6 weeks, in which case all the swelling will have gone normally, and that's when we take your post-operative photographs. We can give you a copy of those. We can give you a copy of the befores and afters if you'd like. And then after that, we like to see you on a yearly basis. We like to see you every year for a checkup. But we have an open door policy, so if you're at all worried in any way about any aspect at any time, all you need to do is ring up, and we'll see you as soon as possible. So I hope that's clarified some of the issues regarding the surgery. If you do have any more, please contact us. We're either by email or phone, and we'll be happy to answer them.